Welcome to Doctor of Medicine. Today we are discussing an important antibiotic called Leeflox, which contains the active ingredient Levofloxacin. It belongs to a class of antibiotics known as fluoroquinolones, and it works by stopping the growth of harmful bacteria in the body. Leeflox is commonly prescribed to treat several types of bacterial infections. These include respiratory tract infections like pneumonia or bronchitis, urinary tract infections, sinus infections, skin infections, and prostate infections in men. It is available in tablet form, usually as 500 milligrams, and is generally taken once daily, either with or without food. However, it's very important to follow your doctor's instructions carefully. Always complete the full course, even if you start feeling better, to ensure that the infection is fully treated and to avoid antibiotic resistance. As with all medications, Leeflox may cause some side effects. Common side effects include nausea, headache, diarrhea, dizziness, and trouble sleeping. In rare cases, it can cause serious problems such as tendon pain or rupture, mood changes, allergic reactions, or irregular heartbeat. If you notice anything unusual, stop taking the medicine and contact your doctor immediately. Before using Leaflox, inform your doctor if you have any kidney problems, epilepsy, heart conditions, or a history of tendon disorders. This medicine is not recommended during pregnancy or breastfeeding unless advised by a healthcare professional. Also, avoid direct sunlight while taking Leaflox as it may make your skin more sensitive. Try not to take it along with calcium, iron, or dairy products at the same time because these can reduce its absorption and effectiveness. Leaflox is a powerful medicine, and when used correctly, it can help treat serious infections effectively. But remember, it should always be taken under a doctor's supervision. If you found this video helpful, make sure to like, share, and subscribe to Doctor of Medicine. Thank you for watching and take care of your health.